everyone. This is State Representative Kate Lipper-Garabedian. Thank you for joining me for our Conversations with Kate. When I was a city councilor, the city of Melrose did not have any personnel on record who were really supporting social work efforts and mental health supports. And today I'm thrilled to be joined by two individuals who are supporting the city and its residents with social services coordination and supports. So what a great thing to champion and to share out today. So Colin McGowan is our social services coordinator with the Melrose Health and Human Services Department. Colin, thanks for being here.
Hi, everyone.
And Rachael Cordella is the licensed clinical social worker with the Melrose Council on Aging. Rachael, so good to see you.
Thanks for having me.
So we're going to get into a little bit more about what each of you are working on and how you're supporting the residents here, things that we can do to support your work as well. I did want to also hold up a few things from my office that we've worked on over the last 2.5 years. One is that we've maintained a wellbeing resource during the pandemic and updated it periodically to just share out services and supports that are available to people. That can be found on my website, kateforrep.com. We also did a community conversation in January. Rachael, you were actually one of the guests talking about how to have a holistic new year. And there was a lot of intentionality around ways to support your well-being and your behavioral health and your physical health. So you can find that on my YouTube channel. And then most recently, at the end of the legislative session, I was thrilled to support a new behavioral health bill, an act addressing barriers to care for mental health that the governor signed into law on August 10th. Among its provisions, the new law provides resources for acute psychiatric care. It enhances youth access to behavioral health services and programming, including at school. And it expands insurance coverage for behavioral health and for individuals with disabilities over 26 to remain on their parents' health care plan. You can learn more about that also on my website. So now I'd love to turn to you, Colin and Rachael, to hear a little bit more about each of you and the work that you're doing here in Melrose. So maybe we'll start with you, Rachael. I think you've been with the city a little bit longer. Could you talk a little bit about your professional background and what led you to working as a licensed social worker here in Melrose?
Yeah, absolutely. Thanks so much. So I actually started my career in public relations, totally unrelated. And I found that what was really making me happy and fulfilling my, my life was working in a volunteer capacity at a homeless shelter for families in New York City. And I realized, why was I spending all day in public relations, which I hated, when I had a passion for something totally different. So I ended up going back to grad school to get my master's and worked for many years in an outpatient mental health clinic on the Lower East Side in Manhattan. So I was based in a school partly, and I was partly in the clinic working with adults and adolescents and families. So that really sort of shaped my early career. And, after that, I ended up taking some time off to raise my two kids, and definitely the hardest job I've had ever and probably ever will. As we know, it's a lifelong job.
Sure.
But when the pandemic happened, I had the opportunity to work with the Community Tracing Collaborative. So that was a group that was doing the contact tracing, and they had another group of care resource coordinators, which is what I did. And basically we were able to get resources to people who were isolating and quarantining due to COVID-19. So a lot of times that was food. People didn't have the money to go get groceries or have them delivered. They didn't have family members or friends who could assist them. If you're ordering groceries online, you need a credit card. A lot of families and individuals did not have that. So they were stuck at home wanting to, protect the public and not go out to the grocery store. And we were able to get groceries to them pretty quickly. There were also a lot of people who didn't have health insurance, who were struggling to pay their rent. And so we would connect them to services to sign up for Mass Health or to sign up for or apply for the RAFT program.
Right.
So all of those sort of resources that were available during the pandemic that people either didn't know existed because they were new or never had the need for before.
Right.
They were able to get connected to these services because we were calling them, every few days to really make sure that they could safely stay in isolation or quarantine and also get what they needed. So that was just an incredible opportunity for me personally. And I felt, that it was really important that I sort of continue that work as the community tracing collaborative was being phased out. And the opportunity came up at the Council on Aging, and it seemed like a really good fit because we do a lot of connecting people to resources.
Yes.
Kind of always being aware of what's out there, being aware of what's new, what's ending. It seems for the last 3 years, it's just been changing monthly.
Absolutely. Right.
So staying on top of that. And also, I think that older adults were very affected by the pandemic because there was that real sense of isolation. So it was just, I had sort of that knowledge, having talked to so many people going through it at the time. I did have sort of an understanding of what was going on when people were so lonely and so isolated for such a long time.
Got it. Well, that's really helpful background. It's neat to hear about your trajectory. I feel like you, on our lifelong learning conversation, talking about a holistic new year, sort of reassessing where you were professionally so many years ago and pivoting has been such a success story for you and now for the community. So thanks for sharing.
Yeah, thank you.
Colin, what about you as, the social worker coordinator for those, the Health and Human Services Department? Can you talk a little bit about your background and how you've come into this role?
Sure. Yeah. My God, where to start? Well, I've been in counseling, the profession of counseling, for my entire professional career. I got my bachelor's in counseling when I was 21, 22. And I've been riding that wave ever since. I've worked in all sorts of different kinds of behavioral health settings, mostly for young people, children and adolescents, young adults, but also families as well. For most of my career, Boston Children's, I was there for a while. With Walker, if anyone's familiar, I worked with them for several years, and most recently with Wayside, and now I found my way to Melrose. I am really passionate about providing equitable and accessible behavioral health services to people. I grew up living with personal challenges with mental health and with family members who really struggled with their own mental health. And I saw firsthand how that affected my life, their lives, and the people's lives all around us. So it was important to me to do something about that with my career, and I love it. So
that's great.
I've stayed in it.
Let's stick with you for a minute. Do you want to tell listeners a little bit about the Health and Human Services Department and sort of what you're doing on a day-to-day basis with supporting the office's mission?
Yeah, it's a great opportunity to be in a municipal department like this, where a lot of people think about the health department or the Health and Human Services Department at this point as inspectional services or the building department as check the codes. I think that the person sometimes gets a little bit lost in that process of meeting these standards and checking these codes. And that's where I come in, is that I get to be the person who works with people and really meets them where they're at and gets them into different types of services that they might need. And, this platform, it gives me all sorts of different kinds of opportunities. It's really like... It's kind of like a playground. I get to sort of come up with ideas that are informed by my experience in my profession and create solutions to public health issues that make sense for the people that are experiencing them. So, for example, we know that from the pandemic, young people in particular are struggling with their mental health and behavioral issues in ways that we haven't experienced before.
Right.
We know that from the most recent youth risk behavioral survey, the most recent community health needs assessment. And based on that, I'm currently working on creating what's called a high-risk case management hub for the school system in Melrose, where teachers, counselors, staff in the schools on a monthly basis, we'll be able to present to a multidisciplinary team of providers these high-risk cases of youth in the city who they're concerned about and they're not sure what to do about. And that multidisciplinary team is then able to consult, refer, and provide case management to that individual, that youth, and their family to give them an opportunity to access needed services, give them a route to healing and better their situation.
That's great.
Yeah.
That's really nice to hear about. What about on your end, Rachael, with the Council on Aging and supporting, the older population, I suppose, here in Melrose? Can you talk a little bit about the Council on Aging and then your role within it?
Yeah, so there's sort of two parts to my job. One, like you said, is with the Council on Aging, the Milano Center, and the other is the Melrose Emergency Fund. So in terms of the Council on Aging, the Milano Center obviously has a huge range of programming, which we always suggest to older adults, especially, coming out of the pandemic and feeling kind of disconnected. The Milano Center is just a great place to go have lunch, meet some friends playing any number of card games or mahjong or, the bingo bonanzas are always very popular. So, that is really just sort of the social center for older adults. And so just supporting that kind of programming. And, we have a great staff in the Milano Center, and if they ever kind of notice that someone is struggling or seems isolated, they always give a heads up to me and to Stacy Mincello, the executive director, and we can kind of reach out and see what's going on. We also have a good relationship with all of the senior housing units in town and work closely with them. If there's a resident that they're concerned about, they can always reach out to us, and we will do our best, to get in touch with the consumer and see what's going on and how we can help. We also, do a lot of connecting people to services. The Mystic Valley Elder Services is a great resource. And
right. I actually just wrote them down on my notes.
Yeah.
So keep going. Yep.
So we refer a lot of people there, and we will connect with case managers and things like that for consumers, that we have in common. There are a lot of just overwhelming aspects of things like health insurance, Medicare, Medicaid. It's really hard to navigate. So just giving them sort of a direction is often all people need to be able to succeed. So, the housing units have kind of lengthy applications sometimes that we help with. Things like, any sort of public benefit that people can be getting, we kind of help them navigate that process and suggest resources and where to go for that. For the Melrose Emergency Fund, that is one-time assistance for people in Melrose of any age. And that's really, the majority of those are things like an electric bill that's overdue, rent that's overdue, things that are just overwhelming and getting in the way of not only good mental health, but being able to stay in your apartment or put food on the table. So we do have those applications come to our office. We review them, and there is an emergency fund board that makes decisions on the cases. So that's also, another resource for anyone in Melrose that is utilized often. And I think it's really unique. I think a lot of cities have something maybe similar, but nothing the scope of what we have in Melrose.
Right.
So that's also a really good resource for people.
That's great. And I actually, on a podcast with our Veterans Advisory Board members, discovered they have a smaller but existing fund as well for veterans that's in the vein of this as well. So a lot of it is just making sure people are aware of the resources that are out there and having people who are that's sort of your mission and your professional career is to connect people. So I'm so thrilled that both of you are here in Melrose. I'd love to hear a little bit from both of you sort of about what you've seen as the most common and pressing issues for residents right now in the Melrose community, and perhaps also how COVID may have impacted those health needs and challenges. And of course, Rachael, you've talked about the isolation. I remember pre-pandemic meeting someone out in the community who was aging in her home and was talking about how already there were concerns about isolation and connectivity. And this is before people were forced into their homes as a matter of medical necessity for a period of time. So there's obviously that. What else are you sort of hearing from or seeing in the community? And Colin, you talked about, youth and the mental toll that the pandemic has taken on that population.
Yeah, definitely. Mental health in general, beyond just youth, is a significant need in the city for sure. But beyond that, I think one of the biggest challenges and needs I see in Melrose has to do with housing.
Yes.
Certainly so. Is that we all heard these stories of people who were protected by the eviction prevention initiatives that were going on during COVID, and also stories of people who lost their income during COVID.
Sure.
And there were points of relief throughout that time, but nothing so substantial that it would prepare people for post-COVID, those eviction prevention initiatives from being gone.
Right.
And those temporary assistance programs from also not really cutting it. And as well, we're also in a period of inflation right now, so people will go out looking for housing, and there's really not many great options out there. That puts people like Rachael and myself in the position of looking into any and every option that we can find out there for these people so that they can stay in the city that they want to be residing in. So it's sometimes tough, but I'm learning more every day about what different options are out there for people. And, I noticed that it's not your typical profile always that you see for people who are experiencing new or chronic homelessness. It's everyone, many, many, many more people are at risk of experiencing short-term or long-term homelessness now because of the lack of affordable and accessible housing, specifically in the Melrose area.
Sure. I heard you say yes as soon as Colin said housing. So
Yeah, that's the first thing on my list here in my notes, affordable housing. I think specifically for older adults, there are a good number of, housing units in the city, but there are long wait lists. That's a huge problem in the area in general. And sometimes people don't know how to access those buildings. They don't know what's through Melrose Housing. They hear that some are private and assume that they're too expensive. And we do have options. It's just there are so many people that are looking.
Right.
And like Colin said, it's not any one situation that's causing it. It's lots of people that have had just a loss of job or a loss of a family member, so they lose an income, things like that are just really affecting it. The other thing that we get a lot in our office are people looking for resources for aging parents. I think that's probably the second most requested service that I get after housing is, it's also housing, that's related, but, my parents are getting older. I don't know if they can stay in their home. Can someone come help them? Should I put them in a nursing home? That kind of thing. And so looking for different options because, you might have an 80-year-old parent who is completely independent, but if you're going to move them, you have to think 5-10 years down the road, what is that need going to look like as they age, so just kind of going through those options. But that's a big one that we get a lot. And then just sort of the lack of mental health services and providers right now with the number of people looking.
Yes.
You can call every provider on your insurance plan and they might all have months-long wait lists. So I think that, some of the insurance companies are helping a little bit by expanding who can provide services and increasing the amount of reimbursement for mental health providers so that people are more inclined to take insurance. But it's a problem. It's still a problem for all ages.
Yeah.
Those are big issues, and it's, on the day-to-day, it's reassuring to know that Melrose has invested in personnel, like both of you, that the Melrose Police Department now has a social worker as well on staff to sort of help people navigate immediate challenges. It's important for people like me at the state policy level to be hearing these stories and thinking about them. I'm vice chair of Elder Affairs Committee this session. It's a new area for me, but I've learned a lot. I've really been interested, for example, in more creative and innovative thinking around housing for seniors and how we might expand models to sort of support autonomy and independence while also providing care and safety measures. And, we have a gray tsunami with baby boomers retiring, so our aging population is only going to expand, and we're already facing housing shortages.
Right.
We also have state policy that we've passed in the last couple of years around sort of housing, in MBTA communities and zoning changes and so forth, because we do have in the greater Boston area a really housing crisis of all levels, affordable housing and, just market rate housing. There's just not enough of it. So I'm very mindful of these big issues and these challenges, and will certainly be mindful of them as I continue to support the district on these types of issues. And then, of course, as the behavioral health bill, now law, gets implemented, hopefully that also will expand access to behavioral health services. So thank you for raising up those issues and continuing to collaborate with me and others in trying to support people here in the community. Maybe we'll turn now to just a final question in the interest of time, just to hear about, you've I can hear from both of you, both from your personal backgrounds and also just the passion that you speak of with these issues. But what are some of the, what you really enjoy most about this job? And then also, how would you encourage others in the community to support your efforts, whether for their own personal well-being or for the well-being of others?
Yeah. What do you think, Rachel? Do you want to go first, or?
Sure. For me, I think it's twofold. One is definitely the Melrose Emergency Fund, and just having people that are so weighed down by this one bill that they just, can't get the bill down. And when we're able to help, I think that really shows the strength of the Melrose community in general. And also just seeing, how the older adults are returning to the Milano Center, and just really so happy about it. It's been almost 4 months now, I think, that we've been reopened.
That sounds right.
And I think that just seeing how happy people are to be back and socializing and returning to their normal activities, or, new normal activities, as they say, is just exciting. I think in terms of the community making an impact, I know that we talked in the community conversations in January about volunteering. That was kind of a big focus that a lot of the panelists had brought up, and I think that's always a great one. I think that, volunteering has been shown to just be beneficial to the person volunteering. It can increase mood. It can decrease anxiety and depression.
Right.
And so if it's sort of a win-win situation for people, if they can get out volunteering, whether it's in the schools, whether it's at the Milano Center, whether you're, cleaning up El Pond, that kind of thing, I think is really good for the mental health of the person volunteering, as well as the community you're volunteering in, and just kind of leads to an overall healthier city.
That's great. What about you, Colin?
Yeah, I'm trying to think about it exactly, because there's just a lot of components of this job that are really wonderful. I think about the people the most, is that the people that I work with really are the things that get me to come back every day, is seeing the situation that they're in, and being that person who can make efforts to help them to change their circumstances. Beyond that, I keep on thinking about the connections that this job offers, and the opportunity that my job gives me to connect different municipal entities back to the community. So I always tell people, like, I love this job because it feels like I get to reclaim municipal government back for the people again.
That's great.
Yeah.
So, final question: how would people reach you if they want to explore something we've talked about today? If they can think of someone who needs some help, if they are looking for a service, what's the best way to find you?
Sure. I guess if you want to call your local health department, the front desk person will direct you right to me. People can book appointments with me as well. We're working on getting that booking system up online.
Great.
To be on the Health and Human Services website. And I can provide case management, referrals, usually starts with an initial consult. People often come to me through the emergency fund, and vice versa. I'll send people to Rachael through the emergency fund as well. So there's lots of ways.
Great. And Rachael, how would people reach you?
So I'm based at the Council on Aging. So you can, again, call the main number for the Council on Aging and get connected to me. The social worker is the option on the phone tree.
Got it.
And that's for, any issues for older adults, and also the Melrose Emergency Fund.
Wonderful. Well, thank you so much. I've been pleased to join today by Colin McGowan, the Social Services Coordinator for the Melrose Health and Human Services Department, and Rachael Cordella, Licensed Clinical Social Worker with the Melrose Council on Aging. I'm very grateful for your time, and I know that the community is so lucky to have both of you working in support of us. So thanks, everyone, for listening to this Conversations with Kate.